welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. Today, let's talk about the top three, I'm going to say frustrations, we're going to call these frustrations, the top three frustrations that I see and I hear from my patients and from prospective patients and consultations and emails and messaging and everything that I get all day, every day on every channel possible. What are the top three frustrations that I hear from you guys with medical management of Hashimoto's or lack thereof, in parentheses? The medical management of thyroid conditions in general in this country, in mainstream medicine and Western medicine. Now, I say or lack thereof because obviously many of you who are listening right now know that mainstream medicine doesn't even treat Hashimoto's, they ignore it. We're going to get to that. So let's kind of jump right in today and let's dig in. These are in no particular order, but the one I hear probably the most is that my doctor is just treating the labs, right? My blood work or my symptoms, if you will. Even they don't even really do that usually. It's like they're just looking at my blood work and they're just treating me based on my blood work with medications or the thyroid hormone replacements. Like that's all they are. So levothyroxine or levothyroxine, Synthroid, Armor, Tyrosint, you name it. Or they're not treating me, even though I have all these symptoms, because of my labs that are normal or quote in range. And so they're not lifting a finger. So what do I hear from patients all the time? Well, all they're doing is considering or looking at what the lab shows, and they're not listening to me. They're not listening to the issues I'm having. They're dismissing my concerns or my symptoms because all of my levels are, quote, normal or in range. And or someone who might be on thyroid hormone replacement, they're already on medications. They'll never change the dose of the medication based on how someone's feeling or their symptoms, because they are in range. No kidding. They're giving them medication that's designed to keep those levels in range. When I say levels, we're primarily talking about TSH, right? Which is the only level that's ever checked. So I get it. Incredibly frustrating because you're not being heard, number one. Your doctors are literally just looking at a test or a couple of tests, and that's how they're deciding. That's where they're making their clinical rationale or their clinical judgment. They're not treating the patient, they're treating the labs or they're treating the lab tests with medications or not. If the labs are normal, they're not going to do anything. So the problem with that, obviously, is not helping a lot of people. The majority of people with hypothyroidism in this country, have Hashimoto's, the overwhelming majority, 9 out of 10, have Hashimoto's number one. So that scenario that I just played out, looking at labs, primarily TSH, dosing medication based on that or not, doesn't do anything to treat the Hashimoto's. We've talked about that numerous times on these talks, is a totally different, treating the Hashimoto's requires a totally different path, including figuring out root causes, implementation of an AIP protocol, to get to the bottom of what's causing the autoimmune condition and getting it treated properly. Okay. That's not even on the radar screen. So I get it. Because you guys are suffering, a lot of you with symptoms. I know because I hear it all day, every day, and I talk with you guys all day, every day. And you're going to your doctors and you're looking for answers and you're not getting them. That's beyond frustrating. It's like your car's making this noise and you take it to the mechanic, and every time you take it to the mechanic, they hook it up to this machine. The machine tells them nothing's wrong with it, and they send you on your way. And you've been back to the mechanic 20 times with the same problem, and they're telling you because they hook it up to this machine and their machine tells them there's nothing wrong with it, that there's nothing wrong with it. Then you start thinking you're crazy, which is just the opposite. They're crazy. So how frustrating would that be? The car just keeps breaking down and breaking down and breaking down. It just keeps getting worse. Same thing. Number two top frustration. Again, these are in no particular order. Medicine in general, again, mostly the doctors, again, the medical establishment, kicking the can or passing the buck, chalking up symptoms that may very well be due to Hashimoto's, but they're not going to admit to that because they've A, never checked you for it, or B, they've checked you for it and they can't treat it anyway. They're going to dismiss the symptoms. Things that I hear from my doctors all the time. All they're doing is sending me to another doctor, another specialist, based on whatever my symptom is. Oh, it's a neurological symptom, see the neurologist. Oh, it's a, soft tissue issue or a joint issue, go see the rheumatologist. Oh, it's a gut issue, go see the gastroenterologist. These are things that I hear all the time. They're always sending me to another doctor for evaluation and treatment. Not even just the thyroid. Oh, go see the endocrinologist. All they're doing is kicking the can. And even if it's the specialist sending you back to the primary care doc. It's incredibly frustrating because everyone's just passing the buck. Everyone's kicking the can down the road and nobody's actually rolling up their sleeves, figuring it out and offering a solution or offering treatment that's going to treat it and get it fixed. It's just kicking the can and treating symptoms with pills at best. And my patients tell me, I don't want to go to more doctors. Like, I've been to 12 doctors. Nobody's fixing anything. Nobody's doing anything. I don't want to call and make more appointments. First of all, you call a specialist, you got to wait 3 to 6 months to get an appointment anyway. I could be dead by then. Jeez, man, I tell patients they got an appointment, they meet me, they got an appointment set for their endocrinologist, in 3 months or 6 months. I'm like, hey, listen, you got Hashimoto's. Let's get to work on treating this now. You'll be better by then, and you can cancel that appointment. You don't even need them. All the stuff that is ridiculous. I don't want to go to more doctors. I don't want to make more appointments. I don't want to sit in waiting rooms. I don't want to fill out more forms. I don't want to take more drugs. I don't want to do more labs. I don't want to be told that nothing is wrong when something is wrong. And again, most of the time it's because A, someone has not been diagnosed with an autoimmune thyroid condition, or they have and it's not being treated. Just keep chalking it up to something else. Oh, it's stress. Oh, you're a new mom. Oh, it's menopause. A million things. You guys have all heard this stuff before. So incredibly frustrating. I get it. I totally get it. All right. Number 3. Again, in no particular order. Frustrations. Again, that's stuff I hear from you guys all the time. This is what I hear. These are the top 3 that I hear all the time. That's why we're reviewing them today. And again, we're going to kind of summarize and we're going to find solutions to these. That's the point. For those of you who maybe have never heard me before, when I give these talks, it's always going to be teaching on a subject, a lot of times identifying a problem, and then discussing it in depth, and then really trying to find a solution to the problem. I'm very solution oriented. And as my patients will tell you, the third huge frustration, and this is especially for people who have been diagnosed with autoimmune thyroid already, Hashimoto's, Graves', they go to their doctors and their doctors will not treat the cause of the problem. Frustration number 3, maybe the biggest one, not treating the cause. The cause is autoimmune disease. All the levothyroxine in the world, all the blood testing in the world, all this stuff is not going to treat the cause of the problem. Now, here's the thing. Western medicine doesn't ever treat the cause of the problem, especially with most things. But so going to your medical doctor, your primary care doctor, your endocrinologist over and over and over and over and over and over and over again and banging your head against the wall, expecting them or hoping that they will finally get it and figure out the cause and treat the cause, expecting them to do that is always going to end in nothing but frustration. That they're never going to do it. And most of you, that's why you're listening to the sound of my voice right now, or would ever listen to the sound of my voice, because we do the exact opposite of that. We have to get to the root cause of everyone's autoimmune problem and get all those cards on the table and then get a plan in place to fix that stuff. That's the only way anybody's going to get better with Hashimoto's or with autoimmune thyroid. And it's just not done in medicine. It's never done. It's never going to be done. They don't get it. They don't have a treatment for it either. Like, even if they identify the Hashimoto's, they don't have a treatment for it. When you're a hammer, everything is a nail. So all they do is look at your blood work, and when you're out of range or you're clinically hypothyroid, here's your hormone replacement and send you on your way. That is it, gang. Expecting anything else is never going to happen. So the quicker you can realize that and understand that and kind of internalize that, then we can pivot, go in a different direction. That's why you're here. And we can go a different plan. We can put together a different strategy that's actually going to get to the cause of the problem and get it figured out and get it treated. That's the only way it's going to get done. That's it. Trust me, I wish it were easier than that, but it's not that hard either, but there's just no one out there doing it. So I hear things like, doctors telling their patients all the time. But then they come to me and they're like, well, I don't get it. There's nothing they can do, for example, about their antibodies, their high antibodies. It's to be expected when you have Hashimoto's, you're going to have high antibodies. Okay. It's not terribly wrong to say that you have Hashimoto's, you're going to have elevated antibodies. To say there's nothing you can do about it is false. There's nothing they can do about it. But all day, every day, my patients, we get their antibodies going down over time by treating the problem. The antibodies are a sign. It's something we can measure of what's going on with the Hashimoto's. Saying there's nothing you can do about them or getting them to go down, they don't have anything to get them to go down because they're never going to do anything to make them go down. And yes, they're always going to be present, but we want to get them as low as we can. It's false. A lot of things, another thing I hear a lot of times, that my doctor just doesn't understand that the thyroid is actually the victim and not the cause of the problem. That's spot on too. The autoimmune condition is the cause of the problem. The thyroid is the innocent victim. But again, they're focusing over here, treating the victim instead of cutting it off at the pass and fixing the problem. You guys get frustrated with that. I get it. I'm trying to alleviate some of that frustration for you because you guys get frustrated with it. I get it because you bang your head against the wall with your doctors. It's a frustration that you can actually overcome is by don't even bother having that conversation with them. Set up a consult, have that conversation with me. Let's get to work. Because they're never gonna see it. You're making too much sense. They don't have a drug to give you for it, and that's how they operate. So it's just not gonna happen. It's not gonna happen in that world. All right. So listen, I said there were 3. I have an honorable mention. I actually have a 4th. So I have an honorable mention, and unfortunately, I get this question all the time. You see people posting it all over the internet and my Facebook group and here and emails I get and all kinds of stuff. And this is unfortunately just some of the brainwashing, the mainstream medicine's brainwashing that most of us have had to endure. And the question is, what do I take to help with XYZ symptoms? Weight gain, hair loss, fatigue, you name it, fill in the blank. What do I take to treat that? Because mainstream medicine gives pills to treat symptoms. So you go in with symptoms and they give you a pill to treat the symptoms. Okay. I have this conversation daily with patients and with anyone who's asking me, what do I do about XYZ symptom? And it's my usual answer all the time. We don't treat symptoms. The symptoms are coming from a cause, from something causing the symptom. We figure that out. We treat the cause. The symptoms go away. So there is no magic. There's no magic supplement. There's no magic pill. Again, I know we've all been brainwashed to think that, but it doesn't exist. There's no magic thing to treat the hair loss or whatever. You may get some temporary relief, but it's not fixing the problem. The cause of the problem is the Hashimoto's. That's causing all the symptoms. Mainstream Western medicine is going to live over here and treat symptom land with pills, whether it's supplements or medications, I don't care. We want to live over here, which is this thing that is causing the symptoms. Let's figure out and fix the thing, which isn't as sexy. I get it. It's not sexy and it takes work and it takes time, but let's fix the thing and then the symptoms get better. So if we actually want to get better, that's the way we have to do it. Everything else is band-aiding at best. So that's honorable mention. That's number 4. Because I get that one all the time. I get it. I totally get it. We're programmed to think this way. Man, I have these terrible symptoms. What do I do about it? What do I take about it? We need to shift the mindset. It's like, we're not treating the symptoms. Let's figure out what's causing the symptoms and let's fix that. And then the symptoms take care of themselves. That is my top 3 frustrations /4 with honorable mention. Listen, in summary, the way to fix it all is go a different route, right? We have to go a different way. We have to go the functional medicine route, but really even more specialized with treating Hashimoto's in general. It's most of my patient population, obviously. Really, it kind of applies generally to anything. So you get type 2 diabetes. Well, they're just going to give you pills. Why don't we just fix our diet, fix our lifestyle and nutrition, and then we fix the diabetes, the type 2 diabetes. So, I mean, it's a mindset that is not, I get it, it's not American because we want it now, we want it fixed yesterday. But that's the way it has to be done. So the take home for today is, yes, these frustrations are very common. They're common for a reason. Everyone's going this way, right? Everyone's going down this path, and then everyone's got the same frustrations. So what do we got to do? We have to do a 180 and go down an entirely different path. We have to take an entirely different approach to managing and treating Hashimoto's, which, again, generally speaking, you've heard me preach over and over and over again, identifying someone's root causes, implementation of an AIP protocol, which is diet, nutrition, and lifestyle stuff to help get everything treated, specific to that individual, of course. That's it. Those are the two things that have to be done. And that doesn't sound anything like what's coming out of your doctor's mouth. I get it. Your medical doctor's mouth. So those are your frustrations. The overarching solution is got to take a different path. If the definition of insanity is doing the same thing over and over again and expecting a different result, it's never going to happen in mainstream medicine. So we got to go a different way. I'm here to help you with that. If you need help with a different way, I am a different way. My whole career has been a different way, so I hope that makes sense to everybody today, and I hope this chat was helpful. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.